Cardiovascular disease in India is attaining an epidemic proportion recently, and in the coming days, the problem is supposed to increase further. This has happened because of many factors. One of them is definitely increasing affordability, but at the same time, the alteration in the lifestyle management associated with increased stress of job is causing its toll on the cardiovascular health of Indian population. Out of this Indian population, again, the disease is happening in an increasing fashion in the younger age group, even at the age below 30 years. There are so many factors associated with this, like hypertension, increasing incidence of diabetes mellitus, increasing obesity, lack of physical exercise, increased smoking, especially in the young working women. Then, last but not the least, is the dyslipidemia. The dyslipidemia means increase in the lipid level in blood. There are many lipids like cholesterol, triglyceride, and lipoprotein A, as well as there may be various subgroups or fractions of cholesterol, which can be in the form of LDL cholesterol, HDL cholesterol, VLDL cholesterol. Now, in Indian population, there is a peculiarity as compared to the Western population. These are low HDL level, second, high LDL level or normal LDL level, and third, the increased triglyceride level in India is causing a very peculiar situation that is called as malignant coronary artery disease. Now, associated with this, there is another factor known as lipoprotein A, which may be a marker of coronary artery disease in genetic form, or may be a manifestation of the disease in the later phase. Now, when this kind of situation occurs, we call it lipid quartet in the form of high LDL or normal LDL level, then low HDL level, high triglyceride level, and may or may not be associated with high lipoprotein level. Now, in this scenario, there are certain things we can do which is not comparable to the Western counterparts. In the Western counterparts, the treatment of hypercholesterolemia is standard. They treat with statins, which is known as the HMG coenzyme inhibitor. And these inhibitors have got different types, like high intensity statins, intermediate intensity statins, and low intensity statins, which is dependent on various level of efficiency of the cholesterol or LDL cholesterol lowering fact. Now, with this, there is another kind of therapeutic modality known as the controlling the target level of LDL cholesterol. Usually, we are more happy with the targets, and 70 milligram is the cutoff point for LDL cholesterol, and we are to take down the LDL cholesterol level below 70 milligram percent, or we can reduce it by 50% from the basal level by giving the high intensity statin in patients who are having high risk for atherosclerotic coronary artery disease. Now, there are certain patients who are having high risk for atherosclerotic coronary artery disease. Out of these, definitely the associated cardiovascular risk factors like hypertension, diabetes mellitus, then obesity, which is also known as metabolic syndrome, smoking. There can be influence of the family history, which also guides to determine the atherosclerotic risk factor in a particular individual. Now, based on this, if there is atherosclerotic cardiovascular risk more than 10% per year, then they fall in the group of high risk, and we should treat this aggressively with the various methods, including the statin therapy, as I already told you. Now, in India, only the statins may not be that adequate to take care of the whole profile of coronary artery disease, especially the malignant coronary artery disease, where we must take care of the increased triglyceride level as well, which, when present, we'll have to take care of it with some other drugs like the fenofibrate. Then there is another medicine known as piper, gamma, and alpha agonists. Now, these medicines sometimes reduce the triglyceride level to a very significant level, which might be beneficial for the Indian patients. Another risk factor which must be mentioned in emphatic way, that diabetes mellitus is very, very common, and it is also giving rise to an epidemic form. And along with this, the metabolic syndrome with obesity, lack of physical exercise are also responsible for the hypertriglyceridemia. So adequate control of diabetes mellitus is another important issue which should be taken care of. Then comes the important guideline about the diet. Diet is very, very important. Our people are more fond of now junk foods, which is having lot of fat, especially the saturated fats. Now, these saturated fats are very, very important for generating the atherosclerotic phenomenon with occlusion of the coronary artery. Now, if we can reduce the amount of the saturated fat by giving the proper kind of advice regarding the oil, which is rather heart friendly, then possibly the menace can be tackled in a better way. Then the smoking. We have noticed that recently the girls and young women who are working in, say, the call centers or any other place, they are working sometime at night, sometime at days, and during that period of work hours, they sometimes consume smoke to a huge level. We must take the onus to teach them that this is not okay, and we must advise them that the smoking is very, very hazardous, not only in terms of producing various diseases like cancer, lung diseases and all, it also increases the coronary artery disease. And I think that this population must be targeted in a significant way. And now, along with the smoking, we must again advise them and also others that you'll have to increase the physical activity to a great extent by walking fast, by coming to the working place on foot rather than using the cabs, then also to sit in front of the various TVs and all these places to reduce the amount of rest in the body, which ultimately hastens the process of the accumulation of the fat, and that increases the apple-shaped body, which is a very, very important risk factor as compared to the hourglass body, which is actually having the less chance of developing the coronary artery disease. So, to summarize, I would like to tell all the listeners and spectators that lifestyle management is the crux of the treatment or therapeutic measures we must take to increase the good quality of cardiovascular health. We must not smoke, rather, we must oppose the smoking at all levels, whether at governmental level or at the NGO level or at personal level. We must take care of our dietary schedule by taking less fried food, junky food, and a binge eating. We should not have good amount of alcohol. Possibly the alcohol in moderation is helpful to some extent, but if you take binge alcohol, then it might go in the wrong way. We must consume more fruits. Then, of course, we must take care of the hypertension, dyslipidemia, and the stress and strain, as I highlighted earlier.